This is my continuing coverage of the health care bill, and this time we're going to be talking about GAO oversight. What is GAO oversight? Well, GAO stands for Government Accountability Office. That's what it stands for. Okay, so let's read what it says. Not later than 5 years after the first date on which exchanges are required to be operational under this title. So basically right now they're supposed to be operating in 2014, okay? So this would be about the year 2019. The Comptroller General shall conduct an ongoing study of exchange activities and the enrollees in qualified health plans offered through exchanges. Now, the next thing we want to list is what these studies will review. Number 1, the operations and administration of exchanges, including surveys and reports of qualified health plans offered through exchanges, and on the experience of such plans, including data on enrollees in exchanges and individuals purchasing health insurance coverage outside of exchanges. So let's slow this down for a second. Okay, first of all, the Comptroller General is going to evaluate the operations of these exchanges. He's not going to really evaluate the operations of the health insurances that are being offered, just the exchange itself, to see if these health care plans are legitimate plans being offered, if they're all being offered like they're supposed to be, and everything that's supposed to be listed on the website is being listed like it's supposed to be, so on and so forth. Okay? Now, he also receives reports on the qualified health plans that are being offered through the exchanges to see if those health plans are as legit as they're supposed to be. Okay? And what they'll do is they will offer customer satisfaction surveys to people who participate on this exchange. So if you're participating on this exchange, I would fill out the surveys. That's what I do. Okay? And then he's to compare the experience that people are having on the exchanges with those people who pursue health insurances off the exchanges, to make sure that the ones that are on the exchanges are more satisfied than the ones that are off the exchanges. Okay? The expenses of the exchanges, in other words, finding out whether they're spending too much on paper clips or staples or on computer equipment or anything like that. Claim statistics related to qualified health plans. Complaints data relating to such plans and the manner in which exchanges meet their goals. Paragraph 2. Any significant observations regarding the utilization and adoption of the exchanges. When appropriate, recommendations for improvements in the operations or policies of exchanges. In other words, they evaluate the customer feedback and see if what the customers are saying they could incorporate in the exchanges to make the exchanges better. Okay? How many physicians by area and specialty are not taking or accepting new patients enrolled in federal government health care programs, and the adequacy of provider networks of federal government health care programs. Alright, so the Comptroller General is to find out why these doctors are not accepting people that are enrolled in the healthcare exchanges. Alright. And now we're going to start part 3. State flexibility relating to exchanges. Now we're going to go into section 1321. We are currently on page number 68. State flexibility in operation and enforcement of exchanges and related requirements. establishment of standards. In general, the Secretary of Health and Human Services shall, as soon as practical after the date of the enactment of this act, issue regulations setting standards for meeting the requirements under this title and the amendments made by this title with respect to the establishment and operation of exchanges, including shop exchanges. Okay. So, the Secretary of Health and Human Services sets the standards by which all these exchanges have to operate and make sure that the exchanges are meeting the requirements of the federal government. The offering of qualified health plans through such exchanges. Okay? So the Secretary sets down the rules that says which health care plans can be offered on the exchanges and which ones cannot. The establishment of the reinsurance and risk adjustment programs under Part 5. Such other requirements as the Secretary determines appropriate. The preceding sentences shall not apply to standards for requirements under subtitles A and C and the amendments made by subtitles for which the Secretary issues regulations under the Public Health Services Act. Not sure what that means, but okay. Consultation. In issuing the regulations under paragraph 1, the Secretary shall consult with the National Association of Insurance Commissioners. That's something you guys are more than welcome to look up. And its members, and with health insurance issuers, consumer organizations, okay, and such other individuals as the Secretary selects in a manner designed to ensure balanced representation among interested parties. Whew. There's a mouthful. Okay, I think I'm going to stop the video right there. I will tell you more in a future video. Stay tuned.